Now, international NGO Oxfam has released a report into health services in South Africa, which paints a dismal picture, given the number of rising cases of COVID-19 infections and an already strained infrastructure. The consequences for the country's poor and vulnerable are simply devastating. Joining me to unpack its finding is Ruth Mhlanga. She's the private sector policy advisor for Oxfam, based in London, but working very closely with her South African colleagues. Ruth, thank you so much for joining us here on The Fix. Now, in the introduction of the report, it says South Africa's healthcare system hangs on the edge of a precipice. A combination of profit-seeking private healthcare entities, underinvestment from government, has driven unfair practices in the South African healthcare sector. And the poor treatment of healthcare workers has compromised the quality of healthcare, resulting in healthcare systems, being prepared or ill-prepared rather for the shocks such as COVID-19. That's quite a devastating finding. What made you come to this conclusion?
Thank you, Kirima. Thank you for having us on the show. I think for us, at the core of at Oxfam South Africa's work is gender inequality and workers' rights. And it was through talking and engaging with trade unions in the healthcare sector, such as Wainetu, who are part of this campaign, that we recognize that the healthcare system is ill-prepared for shocks such as COVID-19. And this is because there's been a consistent underinvestment in the work that is being done by healthcare workers across South Africa. And that is because the majority of healthcare workers are women, Black women, and because of that, that work has been undervalued and underappreciated, resulting in the system that we have today that is inadequate for the crisis in front of it.
Now, a lot of, emphasis and attention has been placed on our health services. People have said that the extent to which we respond to COVID-19 will give you an idea of whether or not we can actually roll out the national health insurance system. From where you're sitting and what we've been seeing, particularly in poverty-stricken places like your Eastern Cape, but even here in Gauteng, which is the richest province, beds are full. The system can't handle the strain. Are we any closer to a national health insurance system? What do you make of Minister Mkhize's response and the infrastructure of health generally during this time?
I think there's two things to look at. Well, the first being that healthcare is about care. So any move towards universal access to healthcare that is free at the point of access requires an investment in the people in the system. So that is the healthcare workers. At the forefront, they must be protected. And that means moving towards fairer wages, secure contracts, as well as the benefits around healthcare. And secondly, we need to decommodify healthcare services and ensure that it is free at the point of access for all South Africans, so that all South Africans have access to quality care. At the moment, the report highlights the fact that there is this mixed system in which you have an elitist private care system and an underfunded public care system, with the elitist system supplying only 16% of the population, whilst the rest of the population is forced into an underfunded public healthcare. And this becomes a challenge across the country, both for the healthcare workers and for patients trying to access quality care. So 2 points there, which is we must invest in the healthcare workers. Our nurses and our community healthcare workers must have secure contracts. They must have a living wage. And at the same time, we must decommodify healthcare and see it as a human right that it is.
Now, you make the link in your report between the way in which health workers are treated and the type of healthcare system that we have. If one looks at who's dying on the front lines in COVID-19, it is health workers, healthcare workers, people involved in the healthcare system who, whilst risking their lives, still don't have full PPE, still don't have safe working conditions. How do you reverse this in real time? Because we've got the pandemic that is obviously placing an enormous amount of pressure on an already poor infrastructure. What needs to shift? What needs to change? More so if you look at the budgeting process. I mean, the unions are locked into a fight with the public administration minister around increases that they were supposed to get. They're not going to get it. And a lot of people are saying, no, but, the state sector is bloated. Is our health sector bloated? it? How do we reward people in the healthcare sector without blowing the budget, so to speak?
I think it is a matter of prioritization in terms of what has been prioritized and who is being prioritized. So again, I draw our attention to the fact that this is a sector that is predominantly black female workers on the front line who are contracting COVID in an attempt to save their fellow citizens. And I think for that reason, we talk about the fact that women's work has always been undervalued. We also look at the issue of unpaid care work, and these are the same women that carry the burden of unpaid care work. So to suggest that the system is bloated forgets to look at who within that system has been rewarded and for what. And I think it is also important to note that the private healthcare system in particular has continued to funnel money away from healthcare towards shareholders. So in the last 4 years, we have seen Netcare, Life and Mediclinic give 19 billion rand to shareholders in a period in which they only made 11 billion. Now, that is a choice that they are making in terms of what is a priority. That money could have been invested in workers, it could have been invested in research. And so we see choices that are continually being made which continue to undervalue the work that is being done by women on the front line of this COVID crisis.
Now, of course, this COVID pandemic has focused global attention on the fact that health for profit is simply not viable. This is a public health crisis that we're having in the globe. We've seen millions of people dying, more confined to their homes, and no end in sight because there is no vaccine, there is no cure. Do you think that this is an opportunity in South Africa to kind of rethink the entire health system? And more importantly, will this very lucrative elite health system that you describe, will they play ball considering that they essentially reaping quite healthy and handsome financial rewards of a very unequal system?
Karima, I think you've hit the nail on the head there in terms of this is absolutely the opportunity to reconfigure the healthcare system. I think looking at the resilience and the courage that the healthcare workers have shown should give us the hope that we can do better. And this, as I alluded to earlier, requires us to decommodify healthcare, see it as a human right. And therefore, we need to move towards universal access to healthcare that is free at the point of access. And that requires cross-subsidization. So where we have the wealthiest parts of the population cross-subsidizing for all so that everybody has access to quality healthcare. And I think, as you rightly said, this is the moment to see that the COVID pandemic has put a spotlight on and exacerbated the inequalities that we've seen in healthcare. And it would be a missed opportunity for the world not to see the need to move towards universal access to healthcare.
Now, we've spoken earlier with Neil Coleman from the Centre for Economic Justice. They are very determined to push back the finance minister on his financial priorities. They are looking to see the supplementary budget scrapped. And of course, they're talking about cuts, and a lot of those cuts are going to happen in things like healthcare invariably, given the fact that we have inherited a very patchy system that, of course, was completely under-resourced, particularly if you think of Bantustan areas. If you look at those areas today, they are in the poorest areas and often at the heart of what can't work. Would an organization such as Oxfam get behind a campaign by economists and health academics to have a reprioritization of spending and a rethink of the supplementary budget?
Absolutely. As you would have spoken earlier this year with my colleagues from Oxfam South Africa around the issue of inequality, and I think we would categorize the current policies as being gender-blind austerity policies that fail to see that cuts in social security, cuts in job security, cuts in healthcare all put increased pressure on our healthcare systems. They put pressure on Black women who are currently holding up healthcare system. In fact, nurses make up 77% of the public healthcare system. They are the backbone of it. And of that 77%, we know that over 80% of those are Black women. And when a system fails, when there isn't social protection, it is the women who stay home and take care of the elderly and the children. And so the cuts that we see in social security, in healthcare spending, these are gender-blind austerity measures, which are not in the best interest of moving the country towards universal access to healthcare.
One of the things that President Ramaphosa is fond of saying is that the face of poverty is that of a Black woman. Poverty is feminized in South Africa, as is inequality, and you've made that point consistently. But if one looks at the supplementary budget, and if one looks at budgeting in general, if there isn't a gendered lens through which budgeting happens, to what extent are we, trying to talk after the fact? Because if you don't prioritize women, if you don't put patriarchy at the center of how you want to change power relations, are you ever going to get to spending priorities that actually puts at the center the Black women in South Africa that essentially bears the brunt of the system in the country that essentially, criminalizes poverty?
I think the short answer there, Karima, is that no, we will not see any change unless we start to prioritize Black women and we start to see the value that they contribute to our economies, either in the form of the formalized workspace, such as the healthcare system, or through underpaid care work which they carry. And I think a big part of this is increasing women's participation in decision making. So looking specifically at the healthcare sector, we would ask questions about the leadership there, as we see the vast majority of nurses are Black women, and yet those in management are neither Black nor female. And so again, we're asking questions about who is making decisions on behalf of who. And I think that's one of the key starting points, which is to listen to the nurses, to listen to the community healthcare workers, because they are on the front line and they are best placed to help make these decisions.
One of the things that often, is discussed in South African society is how trade unions organize in periods like this. And obviously trade unions have as its first responsibility to organize for their workers to secure jobs. But sometimes people see that action as being anti-patient, as being anti the ethos that is supposed to undergird the health system. From where you're sitting, from your engagement, how do you see trade unions that organizes healthcare workers, nurses and others conduct their struggles for a living wage, for better working conditions, vis-a-vis the rights of patients, particularly poor people in often, dilapidated public hospitals?
I've had the privilege of working alongside nurses and community healthcare workers as we've conducted this research. And what comes out very clearly is that ensuring the quality of working conditions for healthcare workers is in fact leading towards better patient outcomes. And that's why our report is titled The Right to Dignified Work and the Right to Quality Healthcare. And that is because in taking care of those who take care of us, we are in fact ensuring better quality outcomes. I think it would be a false narrative to suggest that the organizing of workers is somehow against patients' rights. It is in fact in an effort to ensure that there is quality of care. Where there's understaffing, this affects the quality of care. So when nurses, community healthcare workers and the unions are organizing, it is with the view to ensure that they can do the best in their jobs in order to provide the best of quality healthcare. And that's why we are standing in solidarity with them, because it is more than just the workers' rights that are at stake here. It is the quality of healthcare that is available to all South Africans during this pandemic.
Ruth Mhlanga, thank you so very much. She's, of course, from Oxfam, South Africa. Thank you so very much for that explosive report on the state of the health workers and the quality of healthcare in the country. Well, you've had your fix for this week. See you again next Sunday. Thank you so much for watching.